Good afternoon, and welcome to our April 29th Town Hall meeting at our virtual City Hall. I am joined with our co-host here in our City Hall. I certainly want to continue to welcome Bob Snyder, our health officer from the Flagler County Health Department. Thank you for being here as always.
Glad to be here, Mayor. Thanks.
We have our city manager, Matt Morton. Thank you so much for being here again and your continued work. And then we have our fire chief, Chief Jerry Forte, as well. Thank you so much for being here, Chief.
Good afternoon, Mayor and Council.
And then virtually calling in, we have Dr. Stephen Bickle, who is our Chief Medical Officer for the Flagler County Health Department. We have Tony Hoffman, our CEO, a local company that's headquartered here that has proven to be an extraordinary partner. You'll hear more from Tony and Dr. Bickle as well with his laboratory diagnostic solutions that is doing tremendous work. And our favorite calling guest, as always, is Wally Diaquino, our COO of Advent Hospital Palm Coast. So welcome to those on the phone call as well. We continue to monitor where we are currently going through this global pandemic, COVID-19. As you can see, we've assembled our stakeholders, our subject matter experts that continue to provide essential guidance, and we are welcomed by so many community members and residents that continue to be great partners in this pandemic, as well as asking some really good questions. I wanted to start out today a little bit about what we can expect. We are awaiting, just as everyone is, Governor DeSantis, the governor of the state of Florida, our governor, his executive orders to not only be lifted, however, the new recommendations of his reopening phase. And so you'll hear a little bit about that from our chief today, as well as others on the call and here. So I am going to now turn it over to a few for opening remarks. Wally, I'm going to start with you on the phone. I know we spoke yesterday that you felt it was important just as a Advent Hospital update. If you could begin that would be great. He's not here?
He's calling in.
Oh, he's calling in? Okay, so we'll wait, and we will look to Bob Snyder for the update from the Flagler County Health Department.
Thank you so much, Mayor. I'd like to share some data. Statewide, total people tested is 374,025. Total positive cases is 33,198. Total deaths, 1,188. In Flagler County, total folks tested as of this morning is 1,460. Total positive cases is 133. Last Wednesday, it was 81. Of the 133 infected patients, 104 are Palm Coast residents. Total deaths in the county related to COVID-19 remains at 2. The positive news involves hospitalizations and ICU bed demand. We seem to have plateaued and peaked at or around April 16th. The public health focus now is testing, contact tracing, and providing support for our nursing homes and long-term care facilities. Testing needs to continue. We conduct daily testing at the health department in Bunnell and at the community testing site at Daytona State College, the Palm Coast campus. Advent Health Palm Coast Hospital, along with EMS, County Emergency Management, and other partners will conduct testing from 9 to 1 p.m. on weekdays. Please call 877-847-8747 for an appointment. The test will be available to anyone who have symptoms or had close contact with someone who tested positive for the virus. Regarding testing, the immediate goal per the State Surgeon General, Dr. Scott Rifkes, and the Bureau of Epidemiology is to test at least 2% of our population. So far in Flagler County, we have tested 1.15% of our residents. The White House's phased-in plan for reopening the nation includes seeing evidence of a 14-day downward trend in positivity rates among new cases. This has occurred in only 2 of 67 counties statewide, Orange and Hillsborough counties. In Flagler, we have a ways to go, but we are hopeful due to the testing site closer to home and other test site options like the health department, the urgent care centers, and the Speedway. Among our biggest public health concerns involves the safety and health of our nursing homes and long-term care facilities, including group homes for the developmentally disabled. In Flagler, we have 3 facilities where a staff member tested positive, but no residents have. The employees are now quarantined, and as a precautionary measure, the health department began visiting all 71 facilities who care for the elderly and the disabled. We have 5 teams of 2 who are fanning out and reviewing infection control procedures, guidelines for screening and monitoring employees and residents, keeping visitors at bay, and ensuring that they have enough PPE supplies and equipment. We have nurse specialists who arrived in town to assist us with this educational and training opportunity. And just lastly, Mayor and Matt and Jerry, we've just really embraced our roles as disease investigators right now and disease detectives. We're calling up to 250 patients a day who are either positive cases, people who are investigating, they're under investigation, or those prolonged close contacts with infected individuals. So we have about 30 staff members and volunteers dedicated to that very meaningful duty and responsibility. Thank you.
Thank you for that update. Tyler, do we have Wally on currently?
Not currently. He'll be
Okay.
in the next minute.
Okay, so Chief, I'm going to ask you for an update. I know you have one of your captains that's sort of managing this from the county liaison perspective. If you could just sort of provide that update, I think that'd be helpful.
This past week has been very busy for senior staff and the people that are organizing this at the fire department level. We put together the rollout plan at a high altitude level last week. This week we're drilling down by department, by sub-department on exactly what would happen if the governor does give us the go-ahead and enter phase 1, and what's that going to look like. There are a lot of unknowns when we did the plan last week, like distancing, how many people could be in a group. And once we get that information, when the governor makes that release, that information can then be applied citywide, and each department will know how to respond and react when we do open up. Eventually, we're going to have to get out into the community and start seeing how the opening is going to proceed. And the best way to do it is to have an understanding from the governor's level all the way down through the emergency manager. And that would be Captain Asconi's role, is getting that information and tying it into the plan that we started last week, and then incorporating it in department by department on how it's going to affect it. Each department will be different from all the others. The Public Works Department has already got things set up, and they're scanning each employee as they're coming in, and that's what's been going throughout the rest of the city as part of future planning. What has to be considered is the outward services that we do, inspections, code enforcement, how we do these things on a grander scale. And now that we have more information coming, they'll be able to go out into the community and start to assess what each building, each facility is like, so that they're adhering to the governor's recommendation.
That's a great point, and I think it's important to note to our residents. When the governor issued his executive order some few weeks back, that was the moment where the businesses were shut down. The non-essential businesses were told to close by that executive order. So the city of Palm Coast, obviously, we must comply to a governor's executive order. This is not something that we go in contrary to that. So the rollout plan from the city of Palm Coast that was developed, not only by Matt and, his input as far as the process, but it really came from the professionals that manage crisis amongst many different events that occur. So the rollout plan, what we're hoping is when the residents heed the advice, right, and the the recommendations, that those phases could be adjusted accordingly. We'll talk a little bit about that, but I do think it's important. We are waiting for the governor's order to reopen with his recommendations. We don't know what that's going to look like yet. We don't know what types of businesses he's going to recommend open first, but we have to have benchmarks on these phases. I mean, we have to measure these phases because we have to do it safely. So that cannot be something that's compromised in any way, shape, or form. You know, we're dealing with health, you know, and safety of our community and the residents within. And we do have a substantial high-risk community. A large population, a percentage of our population falls into that high-risk category. I think that's important. But we do have a large city organization with many different departments, with services that we still have to perform. And so when you think about how those city services are plugged into this plan, it could be if groups of 50 are still not allowed, right, or less than 50, or more than 50 are still not allowed, or less than 10 or more than 10, and we don't know, then we have to make adjustments for city services, whether it be our community center services that we provide to our residents, our summer camps, our swimming pool. So we have a lot of facilities that we maintain and a lot of city services that we are actually performing. And so those conversations you have the executive order from the governor that talks about the businesses, but you have a phased plan that our team has put together that takes a lot of things into account, not just one singular thing, but many things that really have to do with ensuring the safety of, right, our team members, yes, but also the safety of our residents, and continue to be in coordination with the recommendations of the governor. So I think that just needed to be stated because there's many moving parts to this, and many different supportive players that play a key role in this as well.
I think Bob can reinforce the idea that these ideas aren't made in vacuums. They're not made in isolation. They're made at a higher level than local government. And it is prudent on our behalf to act on behalf of the people we are ambassadors for, and that's the community. And when Bob Snyder and Jonathan Lord are taking this information in at a higher level, it has been vetted, it has gone through many areas of screening. People are understanding of what the dynamic is. And much of the information that we have gotten in the last 5 to 6 weeks was based off of a climactic, large group of people that could have been infected. And it's because of these actions that have reduced a lot of that bubble or the height of the infection to where we are today. So we are in better shape today because of what we've done off of recommendations from the higher level of CDC, Department of Health. Now we've got to look at and assess it and look at what the plan's going to be for the next couple of phases.
Yes. And let's talk a little bit about more of the detail of that. And, you know, again, we're going to throw questions around that have to do with a lot of different applications, whether it be testing, cases and guidance, our reopening, city business. Again, really appreciate the questions that our residents have posed to us because they're important ones. And it's our responsibility to make sure we're responding to them, but also provide the most up-to-date, accurate information that we have available to us. And so Chief, can you explain why your chart for reopening Palm Coast maintains some restrictions into the winter? Shouldn't you wait to see the data over the next few months?
There's no way that we can predict what's going to happen 2 to 5 months from now. What we can only do is plan according to what those phases represent. So with many unknowns, and we have no specific plan in place for a specific date, the reopening is generally tied to what the recommendations are going to be from the governor and the CDC. We couldn't put dates to something, but certainly when you put it into a seasonal, that gives us a lot of latitude to move. With that being said, if we know that we're planning on something in the winter months, which is way off, and we can have this time now, we can plan for those events. If the conditions are so that we go from a phase 1 to a phase 2 and it moves everything up, the planning's already in place. We've already done the homework on what we need to do during that period, and it's just as easy as sliding that from winter to fall or winter to summer, depending on what the phases are and what the recommendations are from the CDC.
Thank you for that. Let's talk a little bit about the testing, and then we'll go back and talk a little bit more about the reopening, because I do think it's important, again, to show that this is a very comprehensive conversation we're having, not one event, but many different ones. So can you tell us the demographics of the known cases in Palm Coast, patient ages, assisted living, or private homes?
Yes, I can answer that, Mayor. So what we'd like you to do is go to www.floridahealthcovid19.gov. And the reason why you want to go there is because this is information, it's through a dashboard that is produced by the Department of Health, and it's got all this information that the inquirer just asked. All the demographics, number of positive cases, by age group, by sex, by ethnicity, by county, by city, by zip code, what's happening in our long-term care facilities and nursing homes. All that demographic information is right there, and it's updated twice a day.
So, you know, I think a few on not only the call, but here. So when it designates the case is travel-related, does that mean internationally or with the U.S. too?
Yes, that could be either internationally, and one of the original group of level 2, level 3 countries, mainly Asia countries, European, and also includes high-impacted states, especially the tri-state area of New York. So Connecticut, New Jersey, and New York, also the state of Washington. And I think that's about it with respect to the states. So that's what we mean by travel-related, one of those high-impacted areas.
So I think probably if you want to take a few of these questions and put them to, you know, a few of the callers in regards to the testing, I think that would be great.
Yep, absolutely. Dr. Bickle, we are receiving questions about the difference between diagnostic testing and the antibody surveillance testing. Can you explain each? And also, can we talk about the asymptomatic folks? How are we going to test them?
Sure. First of all, they're basically just two types of tests. Test for the virus and test for antibodies. Surveillance testing is a strategy. It's not a test. It's a way of using the test. So basically, the virus tests measure active infection, and this issue of asymptomatic, there are two kinds of asymptomatic people that you call pre-symptomatic, meaning it's the day or two before they start having symptoms. So that's one group, and they're actually fairly contagious. And then there's these people who run these low levels of virus and go through the whole course of their infection and have no symptoms. And that group's probably significantly less contagious. And so the people who are, you know, basically, can we find those people? We can only find those people by doing surveillance testing, and even in that case, it'd be very difficult because let's say only 1% of the population has the infection. At any one time, you have to do 100 people, test 100 people to find one person that has it, you know, in a pre-symptomatic or asymptomatic stage. So what you can do is you can do, as you ramp up the testing and do just a lot more of it, you'll be finding more cases, and then you have a much better idea of how prevalent it is in the population, and then that'll help you sort of figure out how to target people. So basically, there's just the two types. There's the virus testing and the antibody. Virus testing is probably positive for 5 to 7 days, 1 to 2 days before people get symptoms, and then, you know, certainly 2 or 3 days after, maybe up to 5 days after, maybe even up to 7 days after. It kind of declines steadily from there. You can detect prolonged viral shedding in longer situations, but most of the virus titers are high in the first week. And then the antibody testing comes later. It's for people who've already had the infection, and it starts being positive like 10 to 14 days afterwards. So it's very useful for people who had an infection or some kind of an upper respiratory infection in the last month or two, didn't get tested. So so they can have those tests and find out if that infection was indeed coronavirus or not.
Great, thank you, Dr. Bickle. And by the way, everyone, the governor did announce that the first week in May, he and the Surgeon General said that the big shipments of antibody testing kits are going to be made available en masse to people in Florida. We're not quite sure which counties will get those first, but anyway, they're coming. And just a great question for Tony, by the way, if you don't mind.
Absolutely.
Tony, you know, antibody testing is what a lot of people have been yearning for and asking about. Can you just explain to us, like, the importance of the validity of these antibody tests? We're hearing around the country that there's a sensitivity issue and a specificity issue, and we want those to be very high in order for these tests to be reliable. Can you talk more about that?
Sure. So with regard to sensitivity and specificity, it really does depend on what type of serology test you're doing, what type of antibody test. There's two main test types. One's the what's called an LFA, which is a lateral flow assay, which is the cards that you see on the news when they're doing surveillance and they're getting blood from a finger prick and putting it on this plastic cartridge. For that to work and become positive for an IgG or an IgM antibody, you have to be within a certain period of the initial infection to still have antibody titers high enough for those to become positive. The other type of assay is what's called an ELISA. And an ELISA assay is one that's performed in the laboratory from a blood draw, serum, or plasma sample sent back to the lab. So it has a higher degree of sensitivity, especially on lower levels of antibodies. And those lower levels of antibodies could be due to a couple of things. Number one, how high was the original infection? If somebody was asymptomatic, as Dr. Bickle mentioned just a minute ago, their total level of viruses, their viral load, is going to be a lot less, and so then their antibody production may not be quite as high as somebody who had was very symptomatic and had a much better immune response. So that's one thing to take into consideration. And the other thing is time from the infection. So if you wanted to see back, more than a couple months, then a very sensitive ELISA-based assay run in a laboratory is going to have a better opportunity to find lower levels of IgG and IgM antibodies, whereas the LFA test I mentioned first, which is a lateral flow, the card test, those are probably useful for somewhere in the 6 plus or minus a week range. It really depends on the manufacturer and how sensitive each one is. So right now what's happening is many tests flooding coming onto the market. They're all being evaluated for sensitivity, specificity, and that's the other side of the testing, is what target on that organism's the genome are you looking for? And so there's a lot of research going around to get very specific to SARS-CoV-2. But in this case, there's not a lot of difference between SARS and SARS-CoV-2 and some of the coronaviruses. And there may also be information, that immunity can come from even some of the other coronaviruses. So there's still a lot of work going on. They need to be used appropriately. I think they're really good for, especially the public health sector, looking to see what population may have been affected where we can't do the COVID-19 PCR type test, but we can look to see is a larger percentage of the population already recovered from asymptomatic infection. That can be very useful to determine that.
That's great. I'm actually, we're now joined by Wally. So Wally, did you want to provide just sort of an update on Advent Health Palm Coast? And then we're going to add some different, or ask some different questions of the panelists as well. So welcome, Wally.
Sure, thank you, Mary Melissa. At Advent Health Palm Coast, our focus is really in 3 areas right now. Obviously, one of them is preparing to reopen soon. We're obviously going to do that based on state and federal and local recommendations from our governments. There are three areas within our plans to open that is very important for us. We want to make sure that through this process, the staff stays safe. It is a new process for us, and we want to make sure that everybody continues to be safe. We want to make sure that our patients are safe as well as we go through these transitions, which might include a number of outpatient services. And we want to make sure that the community understands also how safe it is and what are the steps that we're taking to make sure that everything is safe so they can feel comfortable enough and come and get the service that is needed and not stay at home and allowing any issues to get more serious. Other areas that we're focusing also too is expanding testing capabilities, and I will go into more detail. I don't know if that was already mentioned here. We can talk about it if there's any questions related to testing later. We want to make sure that continue to work with all of our physicians and staff to make sure that they have all the information needed as we go not only through the phase of reopening, but what does that mean going forward? Because we know that practicing medicine going forward, it will be a little bit different because of the current circumstances. So we have epidemiologists and directors, infection control experts, having constant meetings with our physicians and staff, and also providing more communication to our community. So for example, we did have the 800 number that it was virus HQ for our community, but now we also started providing some other means of communication through Facebook. So we have a live series of Facebooks every Tuesdays and Thursdays at 8:30 a.m., which is done by Dr. Brady, Scott Brady, who will interview other experts within Advent Health so we can answer questions that people are sending in. So those are the areas where Advent Health on Pulse is focusing for the past week and a half.
Thank you so much for that update, and, a great partner in Advent Health, so thank you for all you do as well. I'm going to actually turn over to our city manager now. It's city business-related question. I rent my home in Palm Coast weekly during the summer months. I've had a few inquiries about renting. I understand the rental business has been shut down because of the virus. Will I be able to rent starting in June again?
So great question, and thank you very much for that question. As we alluded to earlier, and as the chief alluded to, our opening criteria are based more off seasons than dates, and so I'd be reticent to try to assign a date to a reopening. What we do know as of today is that the governor's executive order 2087, which put a cessation on the rentals, the Airbnbs, and the in-home type rentals, is still in effect. And that was done to stop the community spread and stop the interstate transmission, of the virus. We're going to continue to monitor that situation. Again, we're expecting some guidance today from the governor on what the phased approaches look like, what opening and or travel criteria or restrictions would exist that are going to inform that opening. So again, I wouldn't put a date on it. It appears from the initial view that looks to be either a phase 1 or phase 2 reopening, again, depending on the recommendations the governor follows. Again, those restrictions have been put in place for our community and for multiple communities, again, to protect our populations, to protect our neighborhoods, and very sensitive issue in our community. So we'll continue to monitor that for sure, and follow the best guidance that we get from the CDC. And just a reminder, when he asked that question, again, we as the city did not put that restriction in place, so we'll follow and respond accordingly when we get more information from our healthcare providers, from our health officials, and from the governor.
Thank you so much. Chief Forte, this is about a reopening question. With almost 100% increase in COVID cases in Flagler County for April, why are we opening up non-essential services? If you plan to open up non-essential businesses, will you also be opening up city offices and other government entities at the same time to allow the public to conduct business as usual? If not, why?
This goes back to early days of planning. And 5-6 weeks ago, when we knew how dire it was going to be, we ran some numbers and had an opportunity to look at this. So about 8 weeks ago, it was estimated that 20% of our population of 90,000 people would somehow be infected with this virus in some way, shape, or form, and those were the early numbers where we didn't know what it was. Out of 90,000 people, that would have been 18,000 people infected that would have sought treatment or been out in the community. Of those 18,000 people, 15% were estimated that they would have been needing a ventilator, depending on how ill they were or how. So that would be about 2,700 people, way overloading the system, and because of the actions that were taken, those numbers are way down. We are less than 1.1% of the community so far tested, and we've barely got a 0.009%, Bob, of those who were infected. So we are much better than we are today than what we're predicting for several weeks ago. Although these numbers are rising, and Bob can attest to it, the increase is still much lower than what our anticipation was when we were designing what the outfall would be 5-6 weeks ago. So when we start looking at what we're going to open, we're opening at a much reduced rate of risk than we were 6-8 weeks ago when what we were walking into. So we went in looking at a much worse case, and right now today we're sitting better than what we were 5 weeks ago. So we've got more information. There's a lot more data. The contagion rate is still within close proximity, human to human, but the rate of spread and the amount of people and density in Palm Coast in our area is not as bad as other areas.
I agree, and I think, again, that goes back to really our residents, heeding the warning, the planners, and the experts that really came together very quickly in rapid pace, frankly, in an unprecedented, uncharted territory and time. So that applies to everyone, which we're certainly grateful for. And so I guess I would pose sort of a similar question. Both, Bob, did you want to add anything to that you think would be helpful as, again, the approach of essential, non-essential, that was certainly a governor's order. However, I know that the health department had some input, the Surgeon General, as far as what that would mean for the safety of the community. And then also I'd like to hear, Dr. Bickle's thoughts on sort of this whole reopening strategy, because we get questions often about too soon, not enough, what really should we be looking at?
Yeah, I think that, the White House, they announced their phased-in approach, and I would imagine that the governor's announcement is going to mirror it in a lot of ways, and that is we'd like to see at least a 14-day downward trend and positivity rate in our community. Only 2 counties in my earlier remarks have done that so far, have seen that. So the other 65 counties, we're still seeing an increase in positive cases because we are testing more, but as far as new cases are concerned, we like to see the positivity rate decrease. Right now it's about 9%. We'd like to see it, down to, we just like to see a trend downward. And then my only other comment is when we do open up businesses, most likely, for sure, social distancing, the hand hygiene, staying 6 feet apart from each other, teleworking, all these things are going to be a part of our future, especially as we open up in a phased rolling approach. Steve, any further comments about that? About opening up and when we should open up our economy and businesses?
Well, it's a balancing act. I mean, it's very tricky, and Johns Hopkins, their Department of Health policy came up with some criteria. We don't quite meet all the criteria. We kind of do in certain areas, but not all 5. I think, but on the other hand, there's a lot of consequences to being closed. So I think there are a couple things that are clear. One is we have to just continue to dramatically increase testing, because if we open up, we will find, and it's not working, we will find out very quickly if we're testing enough. That's one thing. We can always adjust. The second thing is that I think we have to ramp up, the measures of contact tracing, which are being worked on, but some of that's personnel dependent. And so I think we just have to be prepared for the fact that this is not an easy process. And in a way, it's almost easier to be locked down because it's very definitive. It's, you know, we just follow the procedure and it's in place. But when you start loosening it, then it's a balancing act. You know, what parts do you loosen, and you're monitoring to see if it's working. But basically, what you're doing is you're trying. All these measures are trying to reduce the contagiousness out there. You know, this R naught that we talk about. So that, you know, various measures affect that in different ways. So we'll just have to really be vigilant and watch how it's working.
That's a great point, and I think, you know, that goes to those sort of uncharted territory that we're all finding ourselves in, and trying to do the best job we can for the health and safety of our community. So this I will pose to the chief as well. This is more a prevention question. You know, what's going to happen with the 65 and older and high-risk people when this reopening plan, you know, does get ordered by the governor?
It's one of those things when they open up the populace, there's going to be folks that are 65 and older that still won't have a lot of what those would consider freedoms, that they can go anywhere and do anything. And it's for those benefits. The vulnerable population of those who have pre-existing medical conditions, those who are over 65, are very susceptible to this illness. Those who are younger than 65 or in good health, relatively speaking, maybe be the ones that are given the ability to go out in general population and open up a little bit more. But those who are vulnerable still have to consider how they interact with other people in the general population, because it's their health at risk. It would be good for that vulnerable group to limit their own access, to take the extra steps, be cognizant of who's coming to their home. They want to be more careful if they don't know who the person is doing services. If they have family members who are out in general public a lot, they might want to restrict that access to their homes, and basically limit their interactions with other people while we still are collecting a lot of this information on positive cases.
So this goes back to, you know, Bob or Dr. Bickle again. I mean, because this goes to that quarantine comment or question. How does the city feel about the herd immunity methodology and directing quarantine restrictions more towards the demographic that this virus targets versus quarantine the rest of its population? I mean, it's not necessarily the city, you know, necessarily feels this way. It's just we're relying on the data that we receive from the experts, and certainly the health department. You know, this is their area. This is the guiding entity, frankly, that has a lot of input in this process.
Well, I'll kick off the herd immunity discussion. You know, it can happen in one of two ways. Number one is we have the vaccine. That's how we can get to herd immunity. The other way is some of the estimates are that you would need to have upwards of 70 to 80% of your population to have the virus, recover from it, then be immune, and therefore you would have herd immunity. But in that case, there's a lot of people who are going to be sick, a lot of positive cases and deaths, and a lot of hospitalizations to get to herd immunity in that way. So thus the balancing act, thus the dance, and thus we need to be really careful about continuing to test, contact trace, and then isolate those who have tested positive and who are infected, so that we can then get that contact tracing done to avoid further transmission. All at the same time, you know, opening up the economy and our businesses in a very strategic, very thoughtful, very data-driven way. Steve, did I at least get it sort of started in the right direction?
Yeah, well, I think that, you know, the key here is this idea of herd immunity. It's great if you can get it from a vaccine, and it's great if you can get it from mild infections that don't cause a lot of damage. It's not going to happen. We're not going to allow it through natural, you know, course of this infection spreading to the community. There's just be way too much devastation. I don't think anybody's really thinking about that again anymore. Sweden's Florida's doing that, but they're sequestering their elderly, and the jury's still out on that. Their cases are still rising, even though they're not super high. So I think, we're really into the suppression strategy, buying time until we get a vaccine. I don't think the herd immunity, it would just cause so much devastation if it happens through infections.
Yep.
With this particular virus, it's really not an option.
Well, yeah, and I think that's important to know because, a lot of times, I know our residents are at home and they're heeding the warning, and yet there's a lot of information that are supplied to them in a very dramatic way, frankly, that, is always ever changing when we get more data and we understand actually how the virus is not only attacking the system. So Wally, I would ask you this question. How many positive coronavirus patients are currently admitted to Advent Health Palm Coast?
I thought I understood the question being how many positive do we have in the hospital currently?
That's correct.
Okay, yeah, we generally don't share out in public what kind of patients, how many of each, to prevent any speculations or to protect our patients in here. But I can say that we have been treating patients, and we're doing a good job in terms of getting patients to go home that don't need to be admitted. And the important thing here is to make sure that they safe here. So I know I mentioned in the past in different venues that we were able to create an area in the hospital to make sure that any positive patients is located there so they're not around other patients in the hospital. So we have a safe behind doors where we have our brave healthcare workers working behind those doors and taking care of those patients to make sure that we keep everybody safe in here.
That's a great question, or the great answer to that. Again, we really deal with, I know I've heard Dr. Bickle many times on the radio with you, Bob, as well, and talking about, right, the capacity of the hospital and how that's important, right, when we make these decisions, because that's that balance of we overburdening the hospital and the impact it has and this virus has. So when you talk about planning and you talk about these discussions, these conversations are happening daily.
Yeah.
This isn't, where we get together once a month or once a week. The subject matter experts are meeting daily to discuss sort of the approach and the safest approach. So I've been asked a lot, and it's not surprising, but the mask question continues to come up, and I guess the mask debate about, are people required to wear masks while shopping in grocery stores, or is it optional? Why is it not mandatory? I'm gonna at first sort of ask sort of the chief, and then I'm gonna ask Bob to pose the question to yourself and then whomever. Mm-hmm.
As frustrating as this can be, it is a recommendation, and therefore a recommendation only is hard to enforce. We fielded several questions this week about certain locations that had people or didn't have people wearing masks at a restaurant or wherever they were, and there's no requirement for anybody to wear a mask. It's also back up to the individual who feels responsible that they should have a mask, or that if they have a cold, to keep it from going to other people. So there's two different approaches. One is for personal protective, which first responders, hospital workers, healthcare workers wear a mask that is rated not to get any kind of germs or virus through the mask. Those are N95s, or we use also K100s that virtually bring down the possibility of contacting through inhalation. The other masks are facial coverings that keep whatever you're containing inside of you from being expelled outward. So when you're out in public and you see people not wearing masks, the perception is they're not sick, they don't have anything, and the best thing that you can still do is keep away from folks with social distancing. They may not have a mask on that doesn't require them to come up to you. You can still stay further away from them than they need to be. So understanding what the covering is on your face and what it's protecting is more important. If you're wearing a cloth covering, It is not going to keep other products from coming into your area and affecting your breathing. It's to keep anything that you might be expelling from getting outward to everybody else.
And Dr. Bickle, Jerry, agree. Dr. Bickle, our position on masks has changed from just 2 months ago, right? We are advocates of wearing masks. You want to expound on that further?
Sure. The initial caution on them, or lack of, in the pushing them emphatically, was that with droplet transmission, they don't really protect the wearer that much. But then a couple things happened. One, it became increasingly clear that there was asymptomatic transmission. So it's been known for some time that wearing the mask keeps the person who has it from spreading it to others. And the more we realized that asymptomatic transmission was an issue, the more it became obvious that wearing masks would protect the community, because people who had no symptoms wearing masks would not be spreading it to others. The second thing is there's been some evidence from looking at the countries that have done the best with this. This is not a controlled study because they do other things differently as well, but these countries have consistently either mandated wearing masks or strongly encouraged it to the point where the whole population is basically wearing them. So, and then the third thing that's coming up is it appears there may be more what we call aerosol transmission than we thought. It's still not thought to be a huge factor, but there is some of it. So that's a third reason to encourage masks. So, short of requiring it, I think we can hardly be more strong about wanting to encourage the use of them for everybody.
Absolutely.
Tony, got a testing question for you. So, without a doubt, right, scaling up testing over the next few months in our country is going to be really important. So, can you talk to us about diagnostic solutions? Number one, where your turnaround times were so wonderful, is that still happening? First of all, and secondly, in the state of Florida, what's been the demand for your services? Because we got to get testing scaled up. Are things going well in that regard?
Okay, so I'll take the second part first, and I might need you to repeat. There was some static came through on the first question. So, yeah, as far as scaling up, right, we have consistently added the ability to run, 1,000 plus a week. We've been scaling that for the last probably 4 weeks. We also scale to a point where we keep excess capacity, because we do frequently get outbreaks, or in some cases we've done a lot of businesses that are essential businesses where they have a lot of employees, and all of a sudden we'll get an extra 1,000 in one day of the swab test. So we keep excess capacity so we can manage increases from various locations. In the state of Florida, we do, right now, we're working with Palm Coast, Advent Health, and the county of Flagler, but we've also taken on drive-throughs in southern Florida. We have 4 drive-throughs that we just started this week. And mostly that's based on turnaround time. A lot of the labs are still, 3, 4, 5, 8 days out on turnaround. That's improving for most laboratories, but it certainly is still an issue. And if you could, Bob, just
Sure.
on the first question.
Yeah, wanted to know really 2 things. Are you doing antibody testing? Are you prepared for that? And has that started? And number 2, what is your current turnaround time for the PCR test?
Okay, so in regards to antibody testing, yes, we do antibody testing. The limitations there are more surrounding the availability of the kits and reagents to run them, as was the case early on for a lot of the swab testing. We can run about 1,000 a day of the antibody test, and as our supplier ramps up, then we'll probably be able to double that volume over the next few weeks, but that's our current volume. Turnaround on that test is about 1 to 2 days, and our current turnaround on the swab test is still 24 hours. There are occasions where it is a day and a half, just depending again on these big volumes that come in. But but we're still, you know, six days out of 7, we're done in 24 hours or less.
Great. Tony, and just another key question. So as the governor's announcement is going to be coming about, and let's say that there are businesses in our community that are now in that category of, for sure, an essential service or activity, and let's say it's a larger company, and that company wants to have a sense for getting their employees back to work, or who needs to telework and who shouldn't, but they want to contact you and they want to use diagnostic solutions to do their antibody testing from a safety and health standpoint. I mean, how can they contact you? Is that possible?
Absolutely. We have already done testing for 6 businesses, medium to smaller sized businesses. We have had contacts from several very large businesses in doing that, and potentially will be. They can visit our website, which is diagnosticsolutionsLab.com, and call in the toll-free number of 877-485-5336, and one of our business development salespersons will help them understand what they can and cannot do as far as testing goes. There's still HIPAA involved, and so just to think that you can have your entire business tested, the owners of the business are not going to necessarily get any aggregate data, because as a CLIA certified laboratory, we have to protect the privacy of the individuals. But at the same time, you know, there's a balancing act there. They want to know the employees. In most cases, about 70% of the employees in any particular business determine that they want to be tested. Some decide they do not want to be, for various reasons. But certainly it will be better to understand, especially those persons who have already had recovered and developed antibodies, that they are not going to be getting the disease again. Meaning symptoms are, if they had high symptoms, if they get exposed again, their response, their immune response will be much heightened and much faster, meaning that they will not develop, you know, disease. But there is a balancing act there. You know, it's really trying to determine, you know, if I'm positive for antibodies, which I am, by the way, do I want, you know, as a person, individual, do I want to share that with my employer or not? I think most people would. But overall, the utility of antibodies can be for both, for getting back to work, feeling a little bit more comfortable out in public, which I think is a very big hurdle that we have to overcome as a society. So I think it is important for a lot of people to understand their status, their immune status, because it does give them a little bit more peace of mind as things start opening up.
Right.
You know, that said, they still need to be careful, because you can still transmit other ways, and you still have to protect vulnerable populations. You can carry it, you know, on your hands, and so you still need to follow. You know, for a period of time, we're all going to have to still follow mitigation, so that we're not transmitting, even if we're not likely to get disease or get sick again. There's still the vulnerable population that we still need to make sure to protect.
Thank you so much for that very comprehensive response. I mean, I think, again, I continue to learn every day some new information that I think is helpful for us. And I'm going to ask one last question to the panel. I'm going to pose it to our city manager, Matt Morton, and then I'm going to just ask for brief closing remarks from those that not only are on the call but are here today that I think our residents would find helpful. This is really about what our essential business, we are an essential business looking to reopen in May. Our small bicycle shop in Palm Coast makes it difficult to maintain safe distancing. We're having an extraordinarily hard time finding hand sanitizer and aerosol disinfectants in order to keep the facility clean. We understand and support the need for these products for first responders and medical facilities, though we're also on the front line that it is absolutely vital we maintain a clean, sanitized facility in between customer visits, and we could create a source of infection spread. Can the city or county help us in any way with acquisition of the disinfectant items? Which thank you so much again to our local business owners that, continue to always just inspire me and amaze me. We will pay for the product and do not want a handout. Without a solution to this, we may not be able to reopen in a safe way. I'm sure we're not the only business in this position.
You are not, and that is a phenomenal question that we just started getting this week. And again, thanks to our residents, we're committed to making people the purpose of our work and making the community the purpose of our work. And this was such a great question. Again, listening to our residents, we just started the conversation this week in response to this, that we believe, how can we help these local businesses in our community source supply, source product? A lot of local businesses don't understand where to look. They may not have the connections or may not even have the knowledge to know what they need to order or what those good practices will be on quantities and how to use the materials. And so we would like to develop within our virtual town hall, our Palm Coast Connect page, some sourcing information and assistance, in fact, to try to get more information and provide some guidance to help our businesses with a procurement chain, with utilization of these resources. Again, because I agree, I think that's going to be a vital link in this as we continue to wear masks, as we continue to distance, that we as a government, our businesses, our community is going to need these resources to stay safe and healthy as possible. So absolutely, we're going to work on that very quickly and see what we can get up on the page, and we'll continue. If you have additional questions, if business owners are listening to this, or people with ideas, we'd love to hear them. This is new uncharted territory once again, but we are definitely willing to do what we can to assist our community.
Thank you so much. Look forward to helping our business owners solve this as we get through the next stage of reopening. So to those on the call, I'm first going to ask Wally if you can provide some closing comments to not only our residents. We're so appreciative of this moment. I might add that each week we've continued to grow with our listeners, but WNZF is broadcasting this live. You will also be able to see a recording of this. Following this, all the answers will be placed on our Palm Coast Connect page along with the questions. And we had over 20,000 residents that even viewed last week. So continue to be informed and stay up to date. It's important. A lot of information just is ever changing here. So Wally, can you provide a last closing comments, please?
Sure. I think that providing a venue and channels of communication through the radio station, the health department is there every week, and we have the town hall here, and we have many others sharing information. It's helping making a difference at our Flagler County and City of Palm Coast. For us at Advent Health, I think the message that we want to send today is to make sure that if you feel that you need to be tested, even if you don't have symptoms, but you think that you were exposed to somebody that might have been positive, we do have the drive-through open, working together with the emergency management and other entities from our county. Today we expect to have, at the end of the day, probably around 300 people that have been tested just today. And we want the residents of Flagler County to take advantage of this. If you're feeling sick, please go by to make sure you go to adventhealthcoronavirustesting.com and register. It makes it much easier and much faster for you to go through. And we are there to serve this community.
Thank you so much for your continued partnership, effort, and ensuring our residents are kept healthy and safe through this time period, and as always. Dr. Bickle, did you have any closing comments that you felt were important for our residents to hear?
Just that, we're entering a delicate time that there's probably going to be some significant changes in the next week or two, depending on what the governor announces. And people should just realize it's going to be an ongoing process. We're going to have to do a lot of testing. We're going to have to see how this goes.
Thank you so much again. Your wealth of information, and it's certainly helped the city tremendously, as well as I know our county partners in an effort to make sure we're moving along accordingly. Tony, did you have anything you wanted to add?
No, not right off.
Okay. Again, you were not only extraordinary for stepping up and offering your services to our local community, but the partnerships go back to that. That has been a critical component to this. And so with that, Bob, did you want to make any closing comments?
Yes, Mayor, again, thank you for the opportunity. Everyone, nationally and locally, the bottom line and the goals for the next few weeks, besides in concert with opening up businesses in the economy, is we got to scale up our testing. We need to increase and make sure we got all the resources needed for contact tracing, and that we have the ability, without question, to isolate and quarantine those who are sick, so we avoid the transmission of the disease. We are blessed to have this health department. We are blessed to have our nursing home and long-term care facility staff. They're the soldiers on the ground. And God bless Adventist Health Palm Coast for, Wally doing up to 300 tests today. That is really going to increase that denominator and give us an opportunity to further capture those individuals who are sick with the virus. So thank you all so much.
Thank you as well. A great partner we really value tremendously. So Chief Forte.
Thank you, Mayor. The next week or two are going to be strange. The information as it comes out is going to need to be interpreted. It'll be disseminated through the state via the county emergency managers. We will listen intently on what Jonathan Lord recommends with his staff on how we roll it out. And then the city's going to have to react and respond to what the recommendations are to get people back out in the community. I think everybody wants to be back to where it used to be normal. We have to understand that there's going to be a new normal in place for quite a while, and then the next phase will take over.
Thank you so much, and stay safe as well.
Thank you, Mayor.
City Manager Matt Morton.
Thank you, Mayor. One of the questions on our list today we didn't get to, and I've been getting it a lot this week and last, was what can we do to show our appreciation for our hospital staff, our first responders, our essential workers? And in my opinion, it's follow the guidance. Follow social distancing, take that very seriously. Wear your mask in public, as you heard today. Wash your hands. Again, we're trying to lead from a position of courage and proactivity, not fear. We've established as a city these gating criteria and what we believe are essential steps to open. My opinion is the best thing we can do to respect and appreciate our critical workers, our frontline staff, our hospital employees, our nursing home employees, our vulnerable populations, is again, continue to understand these measures are real. We're taking them very seriously. We think they're here for a good reason. And please work with us, as you have as a community. Very appreciative of all the support we've received, the positive feedback, the voluntary compliance and willingness to take this seriously as a community. Very, very proud of our community. Just please continue to do that as you, Mayor, mentioned and Jerry mentioned, as we navigate the next few strange weeks. Please hang in there and continue. The measures have worked. I think the measures, the proclamation, Mayor, the activities taken in Flagler County have made a difference, will continue to make a difference, so let's continue to press into those.
Yep.
And just in closing, again, speaking directly to our residents, this Saturday, we have a very large food drive. We understand the challenging times that many of our residents are facing. We know that the unemployment figures are staggering, and our community once again has stepped up. I want to say a personal thank you to each and every member of our community who is helping their neighbors today be able to get a week's worth of groceries on Saturday for a family of 4. That is going to go a long way in helping. Not enough, but it's a start. So keep the monetary contributions coming. Keep the food contributions coming. 2 locations, Parkview Church on Belterre. City Hall is a secondary location on Saturday from 10 to 4. Our distribution sites, a lot of volunteers. We'll have a follow-up, a post wrap-up of this event because too many people to thank right now. However, it's important that we're all in this together. And so not only heeding the warnings and ensuring the safety of our residents, but ensuring that we all get through this together. We look forward to the governor's announcement. We're anticipating it, and we will be ready for it. That planning that our chief spoke about and our city manager spoke about was essential and critical to continue to keep the health and safety as a top priority in our community as we go through this. And we will continue to communicate with our residents. We will continue to participate. We will continue to communicate through our media sources as well, in an effort to, I would say, over-communicate. We cannot over-communicate enough. So stay safe, everyone. Continue to register for our Palm Coast virtual town hall every Wednesday with our partners, and ask these questions. They are vital to the success and the outcomes of how we will see this through. So thank you and stay safe.